Hello and welcome to Nursing Data Matters, the podcast where we break down the latest tools and strategies to help nurses lead the way in data-driven healthcare. I'm Marcus, your co-host.
And I'm Diana. Today we're diving into the section Managing, Organizing, and Analyzing Data from Multiple Sources. Whether you're a bedside nurse, nurse informaticist, or public health leader, this episode is packed with practical tips to help you turn data chaos into clinical clarity.
That's right, Diana. Our key takeaway: nurses can drive better patient and population health outcomes by mastering multi-source data management, organization, and analysis. Let's get started.
Let's kick things off with strategies and best practices. Marcus, have you ever tried to juggle data from ARRs, paper notes, and maybe even a patient's fitness tracker?
Oh, absolutely. It's like herding cats unless you have a solid workflow. That's where platforms like REDCap come in. They let you integrate data from ARs, surveys, labs, and even wearables. Way more robust than a spreadsheet. Exactly. And standardized data entry is key, using structured forms and branching logic to keep things consistent and minimize errors. Plus, automated data flows can pull info from devices and systems, cutting down on manual entry and mistakes. But it's not just about collecting data. Data governance is huge. We're talking clear access policies, think HIPAA and GDP. So only the right people see sensitive info. And don't forget stakeholder engagement. Nurses, patients, and everyone else need a seat at the table.
Consent and privacy are non-negotiable. Use robust consent models and anonymize data for research. And always keep your policies up to date. Continuous quality improvement is the name of the game.
For organization, data dictionaries and taxonomies like NANDA, INIC, and NOC help standardize definitions. Structured data gets coded, while unstructured data like clinical notes needs identification and secure storage. Metadata management is your friend. Always tag your datasets with source collection method and definitions. And don't forget data stewardship. Assign someone to be the data steward responsible for quality, compliance, and lifecycle management. Clarify who owns what, and communicate access rights clearly. Now, let's talk tools. Ever heard of HE systems, Diana?
Health information exchanges. Absolutely. They let you share patient data across organizations, giving you a complete patient history and improving care coordination.
And HL7.4 standards are the backbone of interoperability. They enable seamless data exchange, API integration, and even real-time alerts, so your apps and systems can actually talk to each other.
Clinical data warehouses are another powerhouse. They aggregate data from multiple sources for population health, research, and quality improvement. And when it comes to visualization, tools like Tableau Power, BI, and QClick Sense turn raw data into actionable dashboards.
REDCap is a favorite for research data management, secure, customizable, and user-friendly. Care coordination platforms unify patient records and help with risk stratification, making proactive care possible.
Integration engines bridge the gap between legacy and modern systems, ensuring data consistency and timely access. And for the tech-savvy, or the tech-averse, no-code and AI integration tools make it easy to connect data sources and process unstructured data without heavy IT support.
All right, let's get analytical. Diana, what's the difference between descriptive and inferential statistics in nursing?
Great question. Descriptive statistics summarize and describe your data, like calculating the average patient age or the frequency of a symptom. Inferential statistics, on the other hand, let you make predictions or test hypotheses, like seeing if a new protocol actually reduces infection rates.
Trend analysis is another must-have. Track changes over time, say, infection rates or blood glucose trends. Epidemiological analysis digs deeper, calculate prevalence, incidence, risk ratios, and use regression for population health studies. For number crunching, SPSS and SAS are classics. Excel is great for basics, while R is perfect for advanced modeling. For qualitative data like interviews or clinical notes, NVivo and Atlasti help you find themes and patterns. And don't forget mixed methods. Combining quantitative and qualitative approaches gives you a fuller picture. When interpreting results, balance statistical significance with clinical relevance, and always present findings clearly. Tables, graphs, and narratives make your data actionable.